Hello everyone, my name's Mo.
And I'm Camille.
And welcome to the Pareto podcast.
You're definitely going to enjoy this episode.
Absolutely. Good evening, everyone. Welcome to another one of our Pareto podcasts. And today we're going to be sharing another career insight, but with a special guest, a personal friend, a colleague, Dr Numan Hameed. Dr Numan is a dentist, qualified dentist, and an alumnus of the University of Aberdeen and also St George's University of London. He's going to be sharing his story and his journey actually in terms of where he started, the different routes he took and he could have taken, and how he really ended up in the world of dentistry and really how he's finding it now, to be honest.
Yeah, right. Thank you very much for that introduction, Mohammed. What do you prefer, Dr. Mohammed?
Anything is fine, to be honest.
All right.
So how's dentistry treating you?
Yeah, so where do I start actually? So with dentistry, there's so much to talk about. I could go on all day, but let's get to the basics of what dentistry is. At the moment, we all know like dentistry, getting an appointment at the NHS is very difficult, of course, unfortunately, because of the way things are post-pandemic. It put a lot of stress on the system, and the dentists were closed down, so there was a lot of backlog as a result of that. So at the moment, people are just trying to fill that backlog, and people are on waiting lists for, unfortunately, up to 2 years.
Oh.
So that's the current situation, and private dentistry, is what people are going for instead. But unfortunately, not everyone can afford private dentistry, so that's the challenge we face at the moment.
Of course, I mean, having had dental treatment myself, like with most people, I mean, I'm fortunate enough to have an NHS dentist, so I see them every 6 months. But I know the waiting list for an NHS dentist is a long time.
Yeah.
But from being an emergency medic myself, I know dental pain is probably worse than any pain that most people ever have and ever face in their lives. So you're very much an emergency service, like other emergency services anyway.
Yeah, I mean, like I said though, like pain is very subjective, but because of the nerve supply to teeth, each tooth, there's 32 teeth that we will have, some people have less, give or take, but each one has a nerve supply as well. So that's why the pain can be very excruciating, because each tooth itself, each individual unit has a nerve going to each individual root.
Wow.
Yeah.
Oh, brilliant. So tell us more about your journey, Numan, because I met you when we were at St George's together, studying. You were always the guy with the notes.
What's that? I don't know about that.
No, absolutely. You were always the guy with the notes and the insights, and which was always helpful. But I appreciate you had a little bit of a journey before that, and it was almost like you were carving your own path.
Yeah.
And where you are now, which we'll talk about a little bit later. But we're great to get some insight.
Yeah, no, of course, like with many young people, when you finish school,
We're still young, mate.
Yes, we are. Well, at least by looks. But at that time, you finish your A levels, and I feel like a lot of us, me personally, don't know what we want to do. Like we just finished the school system, and we've always been told, this is school. You need to go to school. Of course, go to school. School's important. Yeah. But after that, it's just kind of like we're out in the world. What do we do? And we need to know what to do from there. And I think that was the point where I needed to figure out, and I think a lot of people could probably relate to this, is that, what do we do after, there's so many career options, there's so many things going on with the way the world is at the moment as well. And I, at the time, didn't really do that well on my A levels, unfortunately. So it kind of limited my options. I wanted to go into something in the medical field, yes. But as you know, with the medical field, it's a lot of demand, and they have the top candidates with all grades. So I just felt, no, I'm not really going to get in. I don't think I should really try. So I thought, let's just go down a different career pathway. And what did I really enjoy at the time? A levels, I did biology, chemistry, physics, and maths. I dropped physics obviously after the first AS level. But biology, chemistry, I always enjoyed. But then I thought I'm not going to do anything in medical related because of the demand. So I went down. The other thing that I enjoyed, maths, problem solving, and things like that. You know, as guys, we love problem solving.
I guess so.
Yeah.
Not to say that ladies don't.
But yeah.
Let's be PC about it.
Yeah.
I'm not joking.
But yeah, apart from that, then I went down the maths line and I did maths with accounts and finance. But when you do at uni, it's far different. Ways at A level, you know, all that calculus, differentiation, and you know, I forgot what else is involved in it. But there's all of that problem solving, you know, quadratic equations. And it's like, oh yes, you got to find out what x is. I really enjoyed that.
All about that.
But after that, when it came to university level, it was like, prove why x equals 0, and it was just that was most of that. It was mostly theory. It was just mostly theory. It wasn't actual problem solving. If you're doing maths, you might disagree or agree, but that was my personal experience. So
right.
Yeah. So after that, I just thought, you know what, I want to go back into the science. Science is what I like. I just want to go. So then I went and got into biomedical science at St. George's, and that's where we met.
Absolutely.
Yeah.
Dressing suavely.
Yeah.
Always had your hair styled.
Yeah.
I remember those days. I was the unfortunate one that would walk quite late into lectures. And,
we all had that.
Actually, we were mutual.
Yeah, we all had that.
We were pretty good like that.
We all had that.
We're pretty bad. Don't be late to this stuff.
It gets pretty awkward.
And we're not like that anymore.
Yeah.
Otherwise we wouldn't really have jobs. But no, absolutely. But and so St. George's. So that was obviously you did biomedical science. That was you also trying to work out what you wanted to do career-wise as well. Is that right?
Yeah. So at that point I was like, I know I want to do science-based. So I went for that, biomedical sciences, and that just further reinforced the idea that I really like clinical sciences, because we had clinical science modules with you guys.
Yeah.
As you remember, like a lot of the lectures were shared, especially in the first 2 years, and it was all about the body systems, clinical signs and symptoms of diseases, and I found that really interesting, you know, how the body works and how things can, you know, so many things in the body, there's so many systems, and how just one thing can go wrong and it can upset so many systems.
It's true.
So from there, I was like, I really do want to be more involved in the sort of clinical aspect and the patient care aspect. So once I did biomedical sciences, I was, as you know, there was a transfer option into medicine at the time.
Yeah.
So I was thinking about that, or just applying externally. Gave them both a go, but at the time, it just wasn't meant to be, so it didn't work out. Applied as a graduate for basically external university through UCAS, as you do, and sat the UCAT, sat the GAMSAT, sat the BMAT.
Big three.
Yeah, the big three. That was the first time I sat UCAT was when I was in my final year in biomed. Then I did sat again during that gap year, which when I worked as an anatomy demonstrator in St. George's. So I spent the year after uni working as an anatomy demonstrator, teaching anatomy. Ironically, to biomedical students.
True, yeah.
And then there was other students as well, like radiographers, healthcare students. They still call them that. I think they were like
healthcare sciences. I think that was what the degree was called.
Yeah, and physiotherapy.
Physiologists.
Okay, yeah, physiology.
Yes.
I'm pretty sure it's physiotherapy.
No, you have physiotherapy students, but you also have like cardiac physiologists.
Yeah, that is healthcare though.
Healthcare sciences.
It's the same thing. So there's physiotherapy. So that was all of that. So I was teaching them, and I really enjoyed it. I really enjoyed that aspect of helping the students, and the students really benefited from that. They came back, they were really happy. I remember a lot of them, got me gifts. So they were happy. I was happy. Brilliant, you know, and I really, really enjoyed that aspect. I still remember, and I hope all those students are doing well now.
You never know, some might be watching.
Yeah, who knows?
Who knows?
Yeah.
But in dentistry was quite. I mean, I remember when you said that when you told me that you were doing dentistry and you were thinking about when you were doing it, it wasn't like normally it's like I'm thinking of being a doctor, thinking of being a pharmacist, thinking of being an engineer. So you kind of know where somebody's probably going to go.
Yeah.
For me, my experience was that I'm in Aberdeen and I'm studying medicine. I'm studying dentistry, and I was like, whoa, that's kind of come out of nowhere, because a lot of people would consider like maybe pharmacy, a few other different disciplines as an example, medicine will try again, or etc. etc. But you did something, I think that's quite unconventional, and it'd be good to understand what your thought process was there.
Yeah, so after that, basically year where I was teaching, I also spent some time exploring options. Had time to study Arabic as well at one of the institutes in London. So I thought I want to kind of explore more options. And while I was applying, I realized that I really really enjoy sciences, 100%. But at the same time, I want something to do with patient care. But I don't. When I really researched and thought about why do I want to do medicine, it's the patient care aspect that I want a hands-on kind of go there. Someone's, for example, comes with a problem, you solve the problem, that's it, and the patient is happy. Of course, you do that in medicine as well, but it's varying degrees of it. Depending on what you're doing. And I just thought there is dentistry. Let me research into it. I just thought in my head it's more hands-on, straight from the go set when I researched the course itself. And then I also realized that the continuity of care, it was you see the patient every 6 months, and you build that rapport, you build a relationship with them, and to a certain degree, it's just they know you and they come to trust you on a regular basis, and as a result as well, they bring their families and stuff, and you get to basically know everyone really.
I do feel dentistry has retained that spirit of continuity of care. I think through yourself I've obtained a lot of insight into dentistry and etc. And there is definitely a massive feature of continuity. And I think medicine used to be like that. In some places in the country it's still like that, but it's becoming less and less like that, if that makes sense.
It makes sense though. If you're not ill or you don't have a problem, you don't want to. Why would you want to go to the doctors? That doesn't really make sense.
Of course.
But with dentistry, it's you never know. Because sometimes there might be a problem. Because there's the unconventional kind of idea that or you can say more actually the conventional idea that if I'm not in pain, why should I go?
True.
But people don't realize that actually by the time you're in pain, it usually means it's too late. It usually means you either need a root canal or an extraction.
Wow.
Generally. Depending on the severity of the thing.
Fine. So it's important to go actually
before you get
at intervals.
Because the tooth itself, the enamel, the white part of the tooth, doesn't have nerve supply. So if it's been destroyed, you wouldn't feel pain. You're not going to feel pain. It's only until it transverses into the inner tooth where the nerve is, that's when you start feeling.
And the enamel is more the protective.
It's the white outer layer, and then you've got the dentine, the yellow part underneath. And once you penetrate that, then you're
problematic. Fine. So Aberdeen must have been interesting.
It was.
I think we're both from London. I'm based in West Yorkshire. Definitely different from London. But Aberdeen must have been a different world.
Going on to that, when I didn't actually get in first time, the second time I applied, so I did the UCAT once, did the UCAT twice, did the UCAT 3 times, and that year also I did GAMSA and BBAT. When I did the third UCAT, it was I'm not getting in, so a suggestion was put forward, why don't you go abroad and study?
Fine.
So
that was an option. Fine.
So then I went to try it out. I thought I wasn't really feeling it that much, but I had just a few friends that had gone there.
Fine.
And they were just you're not getting any younger. And if you keep applying, who knows when you're going to get in and all of this.
Fine.
So just go. I wasn't too convinced, but in the end I just thought, let's just give it a go.
Okay.
So I ended up in Romania.
Oh, right. I didn't know this.
What?
I didn't know this.
I thought you knew.
No, I didn't.
Oh, right.
That's interesting.
Okay.
Anyway, folks, that's just the nature of things. But okay, wow. So you went to Romania. Wow.
In a town called, or a city called, you pronounce it as Iași.
Okay. Spelled as
IASI. So it's not
okay.
correct how it's pronounced.
Fine.
But yes, I was there, and it was a culture shock. It's quite different to what I was used to. Because I had been to the university, fortunately I had an idea of what a London university was like, and then you couldn't help but compare that, unfortunately.
For sure.
So that really I didn't really enjoy that aspect, unfortunately. Those people who came direct from school, I could see that because they didn't have that comparison. They were a bit more well adapted.
Enjoyed it.
Yeah. I enjoyed it, yeah. Obviously, everything I'd gone through, I didn't get in, and I was there as well. I was trying really hard not to think about it, but I just felt like such, in true words, is just a bit of a failure.
Right.
Yeah.
That's obviously that's a difficult spiral to get into.
Yeah.
How did you kind of emerge? How did you? Because
Um,
I know, I'm sure there's other people that might feel that they're in a similar rut.
yeah.
How did you emerge yourself?
It was difficult. It really was difficult. Like every day, I struggled. Like I used to wake up, didn't want to get out of bed. That's the honest truth. I used to just stare at the ceiling and think like, how did I get here? Why am I here?
This was in Romania.
Yeah.
How long did you spend there?
Good few months.
Okay.
Yeah. Good few months. And then at that time, I got an interview from Aberdeen.
Right.
In about January time. So I'd already started a few months before that.
Fine.
Like before December, like before Christmas, I started it. Got an interview. So I went down, did my interview, prepped for it, and then I took my interview. I did my best, and I think the interviewers could see that as well. Because the interviewers see that, they said, looks like you really enjoyed the process because I was just trying my best, being, you got to be confident in the interview.
You have to be.
And just showing them, that I've done my research, I know what I want, kind of thing, as a graduate as well, like, the good thing is, a lot of 18-year-olds, when they apply for medicine, dentistry, they might seem as an impulsive decision. But when you're a graduate, you can show that it's more well thought out, you took time, you researched yourself, you know what you want now.
For sure, and you obviously went through a journey
Yeah.
of trying, testing, working out, whether something is right for you or not.
Yeah.
Even transatlantic, going to another country to see what the process was, and then obviously settled on dentistry in Aberdeen.
Yeah.
And,
that's what happened, and then I took my interview. After that, I went back to Romania though, just in case I didn't know if I was going to get in or anything.
Fine.
Yeah.
So you were there for a few months longer.
Yeah. And then I did get a reply actually. I actually got a reply back in February.
Okay, that's good.
Yeah, it was pretty early, and they actually said, "Sorry, we can't accept you. You did well in the interview.
Fine.
But everyone did well, so they were like, we're gonna put you on a waiting list."
Right.
So that was it really. And at that point, I had already been on a waiting list before that.
Okay.
When I applied previously for other unis, and I didn't get in. So
fine.
Yeah. So I was
for the different courses.
Yeah.
Etc.
Yeah. So when I applied for medicine, I
Yeah.
didn't get in. So I thought that was it. So I just accepted that this is my fate. Stay in Romania and just soldier through it. So at that point, it was really hard because I got another rejection now. So this is my third UCAS cycle and been rejected again, and that was it. First UCAS, second UCAS, third UCAS cycle. So I was just like, I'm not applying anymore. I'm done. 3 UCAS cycles is a lot. And at that point, I just said, just try your best, try to make, be normal, go to lectures, be normal, just try and study and get on with your life now. Yeah. So really and truly, that's what I was trying to do. And at that point, I was really struggling. I just had a lot of negativity, a lot of negative thoughts. So one thing I used to do, and was important for me, just a personal, is that I think faith is important.
Okay, of course.
And I just prayed. I just that was the only thing that kept me going. So I just used to pray as much as I could. And to be honest, in all honesty, I wasn't sleeping that much of the way I was. So because I wasn't sleeping well, I used to just wake up in the middle of the night, just pray. And I used to just pray and pray. But what I was asking as well when I used to pray, I didn't ask for anything specific. Like I didn't say, "Oh, why did this happen to me?" or "Why did I have to go through this?" I used to just say, help me accept the situation I'm in. If this is what's best for me, then just help me accept it. If it's not, then just show me
a better way.
Yeah. That's it. And that's the only thing I asked for. And life went on. just finished so I did the exams there, and then I came back for the summer. So the whole year pretty much was done.
Yeah.
First year of that degree.
Yeah.
Moved on with my life, and came back and just enjoyed time here for the summer. September came around, and I was going to head back to Romania. And all of a sudden, something strange happened. I got a phone call in September. This is like second week of September. So the course, the Aberdeen course starts the first week of September anyways.
Okay.
It's the second week of September anyways.
Fine.
And it said, when I got the phone call, it said University of Aberdeen called.
Right.
I was thinking, why are they calling?
Yeah.
So I picked up, and they were like, something unusual's happened. Someone's dropped out, and we'd like you to offer the place.
Wow.
Yeah. So this was, and I was like, wait, is this a joke? Because I literally had a dream like this. I literally said that to her.
Really?
Yeah, I literally had a dream like this, and when I was sleeping months ago.
Yeah.
And she was like, no, it's not. You're actually offering me the place.
Wow. Wow.
And yeah, but I remember actually going back to that. Sorry, I missed the part out. When I had they rejected me and said that I wasn't in. I didn't get in. I was on the waiting list. Because I was so upset, I was like, let me find out for sure what my chances are. I called them up and I said to them, what are my chances of getting in? Like, where am I on the waiting list? She said, the Aberdeen course only has 20 spaces. Okay. And we've already given out 30 offers. Okay. And we've got an additional waiting list which you're on. And I said to them, can you please tell me what position I'm on the waiting list, just to get a realistic idea.
Of course.
So she started counting like where I was, and every time she counted, my heart just sank and sank.
Oh.
Right? So she said, you are 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. You're 10. You're 10th on the waiting list.
Wow.
Yeah. So I thought, wait. So I thought in my head, there's 20 spaces, you've given out 30 offers, plus there's a waiting list, which I'm the 10th person on. So essentially, you need 10 people to go elsewhere, and another 10 to go. Then you need to go through, so that's the whole year.
Yeah.
So when I calculate the statistics, I thought, let me figure out what's the chance of that happening. I calculate that as something as 0.00006.
Wow.
Of that happening.
Wow.
Yeah. So when that actually had happened, I was like, this is not real. Chances are extremely, extremely, extremely low.
Yeah, so I was really fortunate to also get accommodation. So that was so I didn't have to waste my time, because the other thing I was worried about is just going around and trying to find somewhere when the course had already started, because this is the second week of September now. So he actually started, this individual had actually started and decided to drop out in the second week, which is very unusual.
For sure.
Yeah. So that's, they had already, well, the first week was especially anyways.
True.
So the actual week had just started now, so I just had like 1 or 2 days to catch up. But I just wanted to get in and get started as soon as possible.
Absolutely.
So just got all the paperwork done ASAP and got the first flight to Aberdeen.
Nice. And how was your experience?
Yeah, I mean, I was overwhelmed.
Of course, you must have been, man.
Yeah, I was ecstatic. I just couldn't wait to start. Like, because from what my experience was back in the UK uni. And technically it's a different country, but it's the UK.
True.
And it was great. Like, it was a graduate entry course as well. So 4 years.
Brilliant.
Yeah. So I wasn't really basically doing any extra time anyway, because the course in Romania was 6 years.
Yeah.
So I was still saving a year anyway.
Of course. Yeah. Oh no, that's good, man. I mean, as you've just mentioned it, I'm just kind of thinking about it, because of course some of these details I wasn't really aware of, but honestly, Numan, you've had a journey, man.
Yeah, it has been.
Honestly, and I appreciate that. There's obviously been lots of low moments in that journey, going through the UCAS cycle again and again and again. As you mentioned, the waiting list, etc. And you mentioned that your faith, your religion, played a massive role in kind of anchoring you almost through those experiences.
Yeah, no, 100%. Like, I think everyone's different, but faith is important.
Of course.
Even if whatever you go, regardless of what you believe in, you gotta believe in something to get you through something.
Of course.
And hope is the most important thing.
Yeah. And from my experience, even studying at St George's, like yourself, there were students that were trying to get into medicine, dentistry, other things, etc. And they probably some of them have gone through similar experiences. And is there any other advice that you would kind of share with people going through different similar experiences to yourself?
Yeah, advice wise is it's quite simple. It's just literally just hold on to hope. Like don't give up. Literally,
And just kind
as
of
simple
keep
as it sounds.
plowing through.
But I know it's simple to say and it's harder to do because I've been through it myself. But you never know what door will open. Trust me. Like if you just hold on, you'll never know. But if you let go, you'll always regret. You'll be like, what if? What if I could have done that? What if? If you just hold on a little bit longer, you don't know what door is about to open. But you gotta stay fast. And even how hard it is, you might wake up and wanna get out of bed. You'll be like, oh my god, this is a repeat. Every day is just the same. Like, what am I doing with my life? It's going nowhere. You just don't know when those things are gonna arise.
Of course. So how's dentistry as a qualified dentist now? How's it treating you now?
Yeah, I mean, dentistry itself is great. Like, there's a lot of scope for practice, you're hands-on.
So it's really hands-on. And obviously after graduation, the traditional pathway is to do foundation training. You do foundation training for a year, and that will allow you to get your skills up to date. So, for example, it's similar to foundation training in medicine, except you're doing a dental practice similar to this one, and you have a supervisor. So he's in charge basically clinically of any omissions you make.
Fine.
Yeah. So you're obviously in charge of professionally of how you portray yourself to the patient. But like for example, clinically, if anything goes wrong, your supervisor will step in. So you always have that sort of safety net. So it's a good thing to do, definitely, foundation training.
And that training gives you like a broad-based competency.
Yeah. So you have like a checklist kind of thing at the end of it, and at the end of it you are like a competent dental practitioner, and you can work in the NHS.
Because the degree is quite different to like medicine, as an example. It's as if like you're specializing already.
Yeah, that's exactly what it is. I mean, dentistry, you can just think of it as a subspecialty medicine.
It is.
It literally is. It's just sort of branched off and become its own degree. Otherwise, it could have easily been medicine first and then specialty training in.
Absolutely. So you do a lot of practical skills and etc., and that's reinforced in your foundation training and in your practice.
Yeah, that's exactly right.
So you must see like patients of all ages.
Yeah, you do. And
patients of all dental habits and teeth and hygiene.
You can see all the range.
Fine.
And also, depending on your own confidence and your competency, you can see a range of patients. Some people, if you're working in the NHS, some people will see up to like 20 to 30 patients a day.
Wow.
Privately, though, you would spend, again, because the amount of time you spend with patients up to you, some private will actually do 30, 40 as well.
Okay.
It's up to them. Or some people will spend longer and see only like maybe 10 or 15.
So how does private dentistry differ from NHS dentistry? Sorry, that's probably not clear for me.
Okay, so NHS dentistry.
As you as a practitioner, what would be your expectations be then involved?
Yeah, so with NHS dentistry you have a contract, and that contract is labelled as a UDA, a unit of dental activity, right? And you have a certain number of UDAs you have to complete in a contracted year. So, and there's banding systems in the NHS. So there's band 1, band 2, band 3. Band 1 is equivalent to 1 UDA. Band 2 is equivalent to like 3 UDAs. And the band 3 is equivalent to 12 UDAs. At least that's when I read it. It might have changed now.
Fine.
But that's what it was like back in the day. And each UDA, you get a certain number of basically money from it. So it's like a value to add it to it. Back in the day, the average was about £12 a UDA.
Fine.
So depending on which band you got and what you did, you'd get that money accordingly. And you have to complete a certain number of UDAs. So say, for example, you're contracted to do 5,000, then that's what you need to do. Unfortunately, though, like that can cause a lot of sort of headache,
stress
to people, because they're like, if I don't do it, and I do think that can get problematic. That's just my personal opinion, everyone's.
Of course.
alone.
And whilst I guess if you were privately practicing,
You don't
that
have
pressure
that.
wouldn't be there.
You don't
You
have
have
that.
your own patients. You can choose your patients, etc.
You have the freedom of choosing your own. Well, you shouldn't choose patients. Let's put it that way.
No, I know what you mean. Like, you know, you can choose to have X amount of patients.
Yeah.
You know,
That's
you
it.
don't have to do
Yeah, basically, you can choose
a
the
certain
amount of time you spend. You can spend an hour with a patient. You
Yeah.
can spend 10 minutes. Up to you. Completely up to you. You know, but the main thing is focus on the quality of care with the patient. As long as you know the patient comes in, they got a problem, you solve the problem, they're happy with the quality of service, then you know it doesn't matter if you spend 10 minutes or an hour.
It's fine.
But that's the main thing is focus on the patient care. You know that in private you have that flexibility, but you don't have to be like, I need to complete this many. You can see, even if you want, you can see 5 patients, 10 patients. No,
Entirely up to you.
There's no limit.
And I guess that's good for somebody starting out in some ways. You know, like
It
maybe
is,
like
but
you know, there's not that much pressure, but also at the same time, the more you do, the better you get.
so basically, if you do just graduate, bear in mind, you know, you've been left alone. To go into a private sector, bear in mind, people are paying a lot of money for private dentistry, right? And if you're not that experienced in going straight into private, it could be very demanding. So, for example, I go in and I do a filling for someone, right? Now, they might have paid £200 just for this one filling. Remember that. If that filling falls out fairly soon, right? Patient not going to be happy.
True.
And it's going to come back to you.
You're liable for it.
Yeah. So, and someone who's just inexperienced, you know, you need to work out like why the fillings. You know, with practice, your fillings will stay on because you'll get the right technique. But that takes time, you know. And I feel like if you go straight into private and people are paying money, you know, you're liable to a lot.
For sure.
Because they're paying a lot of money to do lots of big treatments. And if you can't get that standard up to that, and from being someone who just comes straight from med school, that could be very, very difficult to keep up with that kind of demand. Because bear in mind, a lot of these patients might have had a private dentist before, and that had a certain standard. And if you can't meet that standard, they're not going to come to you.
For sure. Okay, no, that's interesting. I think I guess just drawing this podcast to a close, global dentistry. You know, it's first time coming across it for myself, having spoken to you about, you know, some of your adventures. But tell us a little bit more about that.
Yeah, so there's a lot of demand for dentistry in the UK, but there's also demand outside of it, like I said, globally, in terms of, especially in underdeveloped countries. You know, a lot of people never ever seen a dentist in their life. Some of them don't even know what dentistry is, unfortunately, because it's just they haven't been educated in the way to understand the importance of it. So there's a lot of demand in countries in the African continent, in the Asian continent, where people are living in villages and small towns, where you can go as part of a charity, or if you want to go independently, you can as well. But you need to have the equipment, you need to have the right strategy, and obviously the language. So there's a lot of logistical things. So it might be easier to just go with a sort of a charity which, you know, has contacts there. And essentially you can go there and, you know, if the locals have like a dental surgery, they borrow that and volunteer and help, you know, the local community there, educate them on oral hygiene and the importance of oral health, and treat any, you know, conditions they have.
Of course.
Yeah.
And you're going to Uganda, is that right?
That's correct. So yeah, I'll be going to Uganda in the next 3 months now.
Awesome.
Yeah. And I'm going as part with DentAid. So I'm looking to just fundraise the equipment there. So yeah, if anyone can help with that, that would be really appreciated.
Absolutely. We'll put a donation link in the description. So it would be great to sponsor Numan for his efforts in trying to ensure that people across borders also have access to good dental care.
Yeah,
because that affects everything from eating to drinking.
Yeah, of course.
To confidence.
Yeah, 100%. I don't think like the importance of good oral health is just not emphasized, because like you said, the mouth is the gateway to the body. You know, we eat from it, we speak from it. You know, so there's so much, you know, people, if they don't have confidence in the way their teeth look, affects them. They don't want to go out. They don't want to smile. They don't want to talk. And in turn, obviously, that affects their self-esteem. So it's really important. And if they don't have good, oral hygiene as well, they'll be in pain. They won't be able to eat. In turn, that will affect the whole body system.
Of course. And what's next for you in your career then? What else is what's up and coming?
So at the moment, just building on my own clinic and getting patients through and helping as many people as possible. Really
brilliant.
Especially in this time of need where people aren't getting appointments. I'm just trying to make sure that everyone is seen and there shouldn't be any barrier to being seen as well.
Of course.
Yeah.
No, brilliant. Brilliant. Numan, honestly, it's been an absolute pleasure. I don't want to steal too much of your time.
No worries, and thank you very much for your time.
Thank you very much, and for the patience with our equipment today.
Happens.
Honestly, sometimes it's the wrong timing, right?
Yeah, literally.
But it's all right.
We work with equipment all the time, even in dentistry. So
of course, no, absolutely. Thank you so much for your time. It's been absolutely a pleasure speaking to you.
Likewise.
And kind of listening through your story as well.
Pleasure to be here, and thank you for having me.
No, brilliant. Thanks a lot.
All right, thank you.
See you later, man.
All right, see you.